Hi everyone, I'm here with Andres Heuberger he's the CEO, President of ForeignExchange Translations. And this is the first in a series that we hope to be long of coffee interviews. We're in the coffee shop directly below Lingoport's office. My name is Adam Asnes and I'm the President at Lingoport. And we posed a question, actually Chris in our marketing department posed a question on LinkedIn that said, is internationalization too expensive? It got a lot of very excited comments, and I wonder if Andres could add something here on the video.
I was just chuckling a little bit as you were asking that question, just thinking about our clients in the medical device space. They would answer the question with international what? Not even a question of is it too expensive or not. There's just such a lack of knowledge and appreciation for what internationalization is and does that I don't think they could even evaluate the cost relative to the benefit. One of the interesting responses though that I saw in the LinkedIn question was that somebody commented that it wasn't so much about money, that it was more about time involved, and the time, both investment in internationalization and the benefits deriving from internationalization. And I think that really rings true with medical device companies. That's really first and foremost what they're interested in, is time to market. How do we speed this up? Are you seeing that in other areas too?
I see both. And medical is its own animal. I should mention that ForeignExchange really focuses on medical translations. Medical has the issue of not just market forces, but not killing anybody.
Right.
There's a whole liability issue.
Yep.
And so that kind of changes some of the economic argument.
Right.
Lingoport, of course, works sometimes on our services group, works on some really big sites. So it's not unusual for us to have internationalization projects that are in excess of $500,000,
wow,
even quite a bit more than that,
yeah,
that are very large animals. And if the company we're talking with has never performed internationalization, if they're really first branching out into markets where they say need German or need Spanish, often it's like a big gulp,
right,
because that budget didn't exist yet. And so even if you look at it in terms of the cost of what is your distribution cost and what is your value, what are you gaining, you're literally going into business in this country with a targeted product for, say, $500,000. I'm using a high number. It's still cheap, in my mind, but for many people, that $500,000 didn't exist at the beginning of the year in the budget. So cheap is relative.
But and it's on different levels and different scales. I mean, we've seen the same thing, that all of a sudden that budget, that need didn't exist, and then somebody says, oh, but wait, internationalization is really important. In our experience, often that comes out of a problem. There was a problem. Somebody had an issue. The last release missed the mark, or God forbid somebody got killed or hurt, or there was a product recall. Is that your experience too? That it's sort of there wasn't anything because everything was just okay until it wasn't okay?
Yes, I can think of one medical customer in particular who was very concerned because they lost a patient, and they were concerned that there may have been an issue around it. They didn't know for sure, but they didn't want to take a chance.
Wow.
And so they knew that it was something they had to do, and that came even before the market.
It's interesting. I mean, given those compliance issues and risk issues that you mentioned, which is absolutely right, that drives everything in medical device companies. But even so, it's interesting that internationalization isn't more widespread and isn't taken more seriously, because it has such an impact on the safety and usability of a product. It really is incredible that it still is an afterthought, sort of ugly stepchild of it. It'd be interesting to see if that changes. I like to think, not like to think, what I see is that medical device companies are sort of about 10 years behind other software localization companies or efforts, and love to see them catching up and narrowing that gap, particularly in the area of internationalization.
You know, it's interesting, the perspective I have in the medical device field is actually a little different than yours. I think because the people that I talk to are seeking us out because they're really interested in internationalizing.
Yep.
And so I am actually talking with developers that are fairly sophisticated. They think fast. They see where you're going with. There's an awful lot of value in time to market, particularly in that area.
Primarily bigger companies, medical device companies, or smaller?
Larger medical device
larger ones, yeah.
Is what I find. And that's something that I also find with, like, the more internationalization oriented the company is, the easier it is for them to become a customer, because you know, one project we're working on right now is for a very well-known global company, and their immediate goal is to release in 28 languages off the shoot. That is not a neophyte. That is a very seriously experienced company, whereas with a company that hasn't ever internationalized their products before, or their product, often it's deal-based. So it's like, it's a very financial black and white decision. Is this customer paying enough money for us to fund this development? And then is there enough confidence in getting follow-on revenue after that? So it changes the whole ROI model.
Yeah. Well, and you're right. I mean, we've seen that certainly in smaller companies as well, where it's there's one customer in wherever it is, Greece, that wants to potentially buy our product. And, you know, what does that look like? I think the other thing that medical device companies that we're working with struggle with is that there's a lot of legacy material, a lot of legacy code out there, and some of it was written in the dark ages of coding. And bringing that up to speed, I think, also features in the ROI decision. Do we even undertake that effort, or do we just scrap it and start from scratch?
You know, it's funny, I can think of a CT system that we worked on. It's this big system with all kinds of legacy code. It was somewhere over 5 million lines of code. And looking through the source was a bit like an archaeological dig of different styles or programming languages. There was, you know, TK Tickle in there. It was stuff that we don't see that much anymore.
Right.
So
what did you do in that instance? Did you?
Fortunately, it wasn't that. It just meant more time on the design. It meant a little more time on the framework. For everything. But you know.
You know, and I think again, if there's some.
That's
right. Easy for you to say. That's right. I was just gonna say that the client shares that viewpoint because again, that comes down to how much is internationalization appreciated on the client side. So.
All right. Well, anything else to add here?
No. Thank you very much.
We're probably at the northern end of YouTube length, though. Thank you for joining us.
Thank you. Nice chatting with you, Adam.
All right.